In that case, the notch of the superior border is palpated first, and this is having clinical significance. This border is also known as clinical border, and this notch is also known as clinical notch of the spleen, because when the size of the spleen is more than 3 times, in some diseases like the malaria, Kala Jar, leukemias or lymphomas, when the spleen is more than 3 times, it can be palpated below the left costal margin, but can be palpated when the size is more than 3 times to the normal. So this notch is known as clinical notch, and this border is known as clinical border of the spleen. Now, what are the costal relations or diaphragmatic relation of the spleen? Here we will see spleen again. The diaphragm is here. It is wrapped inside the peritoneum, forming the gastrosplenic and lienorenal ligaments. The diaphragm is here. The left lung, the coat to diaphragmatic recess of the left pleural cavity. So left pleural cavity, and rib number 8, 9, 10 and 11. So rib number 9, 8, 9, 10 and 11. So rib number 9, rib number 10 and rib number 11, all three are related to the diaphragmatic surface of the spleen, and spleen is lying in the long axis of the rib number 10. So these are the diaphragmatic relations of the spleen. Outside the diaphragm, there is coast to diaphragmatic recess, and this is the diaphragm, and this is the lower lobe of the left lung. So these are the diaphragmatic relations of the spleen, and these are the visceral relations of the spleen. In next lecture, after a short break, we will talk about the histology of the spleen, how the interior of the spleen is having some closed theory or some open theories of the circulation, how the red pulp and how the white pulp of the spleen are formed, and how the spleen is enlarged in some pathological conditions, and what are the clinical significances of this enlarged spleen.